In this video, we are going to discuss a case of hair transplant failure which was discussed on another video where the patient had to later on shave his head after getting the hair transplant. So welcome to our channel Saraswat Hospital Hair Transplant, where we regularly talk about the information about hair loss, hair transplant, planning of hair transplants, and what all factors can lead to the success or failure in a case of hair transplant. Please subscribe to our channel if you want to know more and more of such content. I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon, and in this field of hair restoration since 2006.
I had a hair transplant, and that was back in 2019. So I had basically all of the front done, the sides done, because I had very receding hairline, as you can see in the pictures.
So this patient initially tells in an interview that he got his hair transplant done in 2019, around 4 years back. So considering this video came out in 2023 and he got his hair transplant done in 2019, that is 4 years prior to that.
A 1 year comparison post, and up to the 1 year mark had really good hair, quite thick, came back really nice.
Initially at 1 year, it is shown that he had good results, which can be seen in the video.
My sideburns here were all receding, so I basically had all of that done, and obviously they took the hair from the back of the head and the sides. But then after that, I don't know what happened, maybe a year and a half later, it just started getting thinner and thinner. And then you can see some of the other pictures where I've got the hairline, but the whole head is just really thin.
So initially in his hair loss history, he started having a recession of his hairs and then he planned a hair transplant. But in another part of that video, he discusses that at around 1.5 years after the hair transplant, his baldness, he started losing a lot of hairs and his baldness became visible in the mid scalp and the crown area quite a lot. That is, after 1.5 years of his hair transplant, his hairs thinned out a lot. Although his hairline was lowered a bit and the front looked okay, but he lost a lot of hairs in the part where the transplant was not done.
Taking finasteride, which I never took before, and that kind of helped a little bit, but not loads.
Then he goes on to say that he took finasteride, but I think that was the time when it became quite late in his hair loss journey when he started finasteride, and the hairs had almost converted or changed from terminal or an intermediate hair to vellus hair, which is a state where medical treatment does not work a lot.
The latest picture where I've got my head down, the real bad thinning, that was last week before I shaved my head. It was just getting to a point where nothing was really working. I just kind of had to go for it and just shave my head. Then he accepted that his results are poor after going through a lot of years and years of mental sort of distress. He shaved his hairs one day finally when he could not manage it and his hairs were not looking any better than what they were previous to the hair transplant. So ultimately he had to shave his hairs. She said, "What the hell is that on the back of your head? Like, there's a big line." And it's basically a big patch on the back of my head from where they took the hair when I did the hair transplant. Obviously I can't see it, but when my wife took a picture, I was quite shocked. I was like, oh, okay, this does not look good, right? Because basically you can see a big patch of tiny micro holes of hair missing, kind of, even though it's done tactically and it's kind of spaced out, but when you've got kind of like this.
But the big surprise was when he shaved his hair from the back, he could see the area from where the grafts were taken out, and there were a lot of scars when he underwent a buzz cut or a shaven look. So this is an extremely important point for everybody to understand, that FUE is not a scarless procedure. Many a times, many clinics advertise FUE as a scarless procedure and FUT as a scar procedure. So this distinction between a scar and a scarless procedure is absolutely wrong. There are micro dot scars which can happen in a case of FUE where you are taking out individual roots using a small size punch. Whatever the size of the punch may be, still it is going to leave some scar from the area where the grafts have been extracted.
It was definitely uni. Even just the first year of uni, I really noticed like my hairline was going back, my hair was getting thinner, just kept getting worse. And then by the time I left uni, I was working and stuff. It just got to a point where it stabilized in that picture that you see, the side by side on the left. It just kind of stabilized at that level. It's funny because my older brother, he's got a full head of hair, really thick, and his hairline's like
as low as you can possibly get.
Then later on, he discusses about his hair loss history, how it started. So he tells us that his hair loss started in university, which you can see in the video. So probably, if he went to university at around 18 or 19 or 20 years of age, and when he joined it, he started having hair loss. So this means his hair loss started quite early in his age. So it is a sort of an early onset androgenetic alopecia, and there is no mention whether he took some medical treatment to prevent further hair loss to stop the progression of the androgenetic alopecia. Medical treatment, if started early, is quite beneficial, and hair transplant is always the sort of a procedure which has to be considered if your hair loss is stabilized, you have a family history of small area of baldness. If the hair loss history is quite extensive, then hair transplant may be giving you suboptimal results. Although in this case, he tells us that his brother had very good hairs, so probably a complete history would have sort of unraveled the exact reason of his hair loss starting so early.
So I kind of had that battle ever since, many years, for at least like 10, 15 years now. And I just kind of got sick of it, because even now I was doing the same. Even though I've had the hair transplant, I've got a hairline a bit further down because it's so thin. If you'd get
Also, he says that it's around 10 to 15 years from now that he started having his hair loss, and 4 years back he underwent a hair transplant. So approximately, if his hair loss, probably his age at the time of transplant lies between 26 to 28, which is an appropriate age for a hair transplant.
What led you then to deciding to get the hair transplant?
I came across it through Instagram, and I saw that loads of celebrities were getting it done. So loads of really good transformations, but a lot of the transformations I saw were people with bad receding hairline but thick hair, whereas I had really thin hair, so I was really skeptical. Is it really going to work for me?
On being asked how did he decide about hair transplant, he says that he saw on Instagram people getting hair transplant done, and a lot of celebrities also undergoing hair transplant, and he went to Turkey.
If I'd known probably back then that I was going to shave my head off and just keep it shaved, maybe I wouldn't have gone. It's hindsight, I guess.
Then he says that if he had known that this is the kind of results he are going to get in long term, he would not have got a hair transplant done. So again, it is extremely important for you to understand that hair transplant is a sort of a long-term commitment. It is not something you go and do it once and then just forget about it. In fact, we have discussed top 10 reasons why you should not undergo a hair transplant, and this is mentioned in the link given above. And if you feel that this is something sort of a too much work for you to keep taking care of your hairs after the transplant, or you don't want to take medicines, or if your clinic has not discussed this with you and you think that single procedure is going to rectify all your problems later on, this is not true. Please do discuss your hair transplant in detail with the clinic. Ideally, in a case like this which has been shown here, a trichoscopy would have shown the kind of hairs he has at the back, and it could have sort of predicted the probable results, which depend on the characteristic of the hairs in the donor site. Although there are always some chances of hair transplant failures even with the best of the clinics, especially if you have some medical problems or some problems with the skin at the recipient site, some autoimmune disorders and all those things. So these all things have to be discussed with the clinic and the doctor before you actually undergo a hair transplant. So this is our take or our reaction on this video. Friends, we wish you very best. We also request you once again to do your due diligence. Also mentally be prepared that unexpected failures can always happen. Never think that every procedure is going to be 100% successful all the time, and you have to accept small chances of failures also. So wishing you all the best. This is Dr. Satya Saraswat again from Saraswat Hospital. If you want to know a long-term result of hair transplant at Saraswat Hospital, please click the video on the left, and if you want to know the medical treatment part, finasteride and other videos, please click the video on the right.